Okay, I got interrupted by a call and my video stopped recording. So here's why I feel like they should have national health care in America, and Trump should do it not tomorrow, not weeks, not months from now, but now. Now. Here's why. National health care here, everybody has it. It's required by law. You have to have it. Normally, if you're with an employer, it's 50-50. Now, if you're an independent contractor like me, you pay it all on your own. They base it off your income. So, if you don't make as much, you pay less for the national insurance plan. If you make a whole lot of money like a doctor or lawyer, you pay more. It's fair. It's very, very fair. Because I'm an independent contractor, they tend to be on the upper scale. Not that we make more money, but when you're an independent contractor, you tend to pay a little more. But even for me as an independent contractor, I pay 40,000 won a month, which is like $30 US. When I was with an employer, it's been a while. It's been almost 2 years. I think it was like $12 to $15 a month, US dollars. The healthcare plan here covers almost everything: dental, emergency room, surgeries, vision, hearing. There's some things like if you get a dental, say like a root canal, the root canal itself is covered. The crown is not. And there are different types of crowns. Is nothing here, even without insurance, isn't that expensive, but you can choose levels. So teeth fillings are covered, but you can get one teeth filling, which is the silver kind. I don't like. I always get the white kind. That is, I believe, free. My husband got that free by the government. But you can pay like 5,000 won, which is $5 US, basically, well, $4 US, and get the white kind. So everything is super cheap here. It's covered by insurance. To just give a quick overview, I've been to the ER multiple times here, but I was in the ER with bacterial pneumonia, which is serious. ICU for 6 days, right at a little bit over 2 months. I was right at 3 months of aftercare. And that cost me out of pocket ICU, going through the ER, multiple CAT scans and x-rays and blood tests, ICU for 6 days. And then the 2 months aftercare included cost me right at $800 US out of pocket. The rest was covered by the national health insurance. Also, a second example, I had appendicitis here. Did not go through the ER this time because I wasn't sure exactly what it was. Ended up going to a regular doctor. They transferred me to a hospital that specialized in appendicitis surgery. And I ended up getting several extras, like I paid extra for having glue instead of physical stitches. I paid extra for having extra pain medication. I paid extra for better anesthesiology person. A few little things I paid extra for that surgery that they weren't that much to begin with. They told me the cost extra, but I probably ended up having $150 US extra because of stuff that I just wanted done a particular way. Didn't have to. My bill for that surgery, if I had not got the extras, would have probably been like $750, $800. But I would say I didn't exactly look at it. I got like $150 to $200 worth of extras, extra stuff that I preferred. So they give you the choice. But I had appendicitis surgery. I did it endoscopically, which was a little more pricier than total like open. And not by much. I think it was like $50 or something for that. But I was in the hospital it ended up being 3 days, right at 3 days. And had the surgery. It was a little more expensive because it was considered emergency surgery. And surgery ended up costing me out of pocket. They covered most of it. out of pocket cost me like right at $900 US dollars. So once again, many people in America would kill to be able to go to the ER and only have and then stay in the ICU for 6 days and only have an $800 bill. Many people would kill in America, I know that, to be able to do that, go to the ER and have be in ICU for that many days and have that bill. But we all know going to the ER is, wow, just walking through the door, no test in America is $3,000 to $5,000 US dollars. Any test, it's just cha-ching, cha-ching, cha-ching. Also, ambulances here, I've never rode an ambulance, but I believe a Korean told me, I had to ask my husband to confirm this. I believe the ambulance here is free, if you call it, or it's very cheap, like $20. It's nowhere near what it is in America. I'm pretty sure I could even pull up my insurance policy. I think it is free for ambulance, if you call it ambulance. Now, helicopter is not, but is once again not $10,000 like in America. I think it's just a few hundred if they had to call the helicopter. I've never seen them call the helicopter the whole time I've lived here. I've never seen it, but they do have it. So I think that's a few $100s from what I've heard for that. So once again, many people would just kill to be able to have a free ambulance ride or a $20 ambulance ride, or a helicopter if they needed it for several hundred. A lot of us would just kill over dead in happiness, you know. So my question is, I don't know why America doesn't have this system. It is so great. For all you people out there that are naysayers and go, oh, the government can't afford this. Yes, they can. And guess what? The doctors and the nurses still make good money. They're still like at the top of the food chain job-wise. So I definitely don't understand why this system is not in America. It really should be. It's so amazing. It's so great. Also, another quick thing I want to tell you guys, I hate referrals. When I was in America, I had to get referred to specialists. It's so freaking hard to get into a specialist. It's just awful. Like, you could wait months for just a specialist. It's terrible. Here in Korea, no bull crap. If you need to see the gynecologist, the dermatologist, the ear, nose, throat doctor, who am I missing? Even neurologists. I've even been to a neurologist here because I was having bad migraines. Guys, no appointment. I've walked into the gynecologist day of 15 minutes I was seeing. I've been to the ENT more times than I can count because I have numerous sinus infections. I walk right in. I'm seen within 10 or 15 minutes, sometimes 5 minutes if it's not busy. And dermatologist, same thing, no appointment. A lot of times I will call to make sure they're open and like to see their lunch breaks and stuff, but they just say, come on in. And I go and I'm seen super quick. Same thing, neurologist. I waited a little bit longer there, like 20 minutes, but no appointment. I didn't have an appointment for any of these things. So I love that system. Like, if I have to go to a specialist doctor, I don't have to get referred. I don't have to all these stupid referrals. I just go and I'm seen quickly and easily. I think pretty much the only thing that you need an appointment for that I've personally made like an appointment for, well, two things. One, dental cleanings. They normally make appointments for that. That's a little different. But if you do have a dental emergency, like a really bad tooth, there's always a dentist that can get you in. Your dentist that you have for cleanings can normally get you in day of. But there's always somebody, if your dentist can't get you in, they normally have a dentist that's maybe right down the road that they say, hey, I can't get you in, but blah, 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 dentist down the road that's, I know can get you in today and then get you started on treatment. So if you do have something like severe toothache, this started, they can normally get you in really quick with themselves that day, or with somebody else down the road that can start the treatment, and then they'll transfer you back over, or you just go back over. You don't really transfer. So, yeah. And as far as your medical records, each doctor has that for you. So if you end up switching doctors, they don't transfer the medical records. So if I go to one dermatologist one day and I go to the next the other day, they don't transfer records. They just ask me what's my problem. They look at my problem. If it was something like cancer or something, that's a little different. They would have, if you're switching doctors, they would transfer records. But it's very easy here. You can actually do it yourself. You can print it out. Actually, you can print out your medical records online from the computer, and you can do it yourself. You don't have to worry about some middle person transferring records. But yeah, doctor records here are not really a thing. They don't really keep up with pre-existing conditions. They don't really care for stuff like that. You just go to the doctor. If you go to a dermatologist one day and another dermatologist another day, they don't transfer records. They just ask you what's wrong, and they treat it. And prescription drugs here are so simple. Matter of fact, since I've been here, they do have generic versions, but most of the time I never bothered with that. So just to give you guys a quick, example, I have migraines. Some of you might know the drug called Imitrex, or the generic version is Sumeptrin. I might be pronouncing this wrong, but this drug, checking time, this drug, normally in America, Imitrex for migraines, is super pricey. I believe even with insurance, especially if you don't get the generic, which is Sumeptrin, it can be several $100s easily. But here, I went here. I had brought some back from America because I wasn't sure if I could get it here. But I looked online. I could get it here. When I was running out, I was freaking out because I was thinking my mother or somebody in America would have to send me more. And I went to my doctor, and I just pointed. I said, "This is the drug I use for my headaches. I get really bad migraines." She looked at me. She said, "How many pills do you normally use?" I said, I don't really use them that much. I get a really maybe debilitating migraine like once every 2 weeks or something, for different reasons, weather, whatever, stress. And she wrote me a 3-month supply, and I went down to the pharmacy. Pharmacies are normally like right up under a doctor's store. They're everywhere. There's a pharmacy around every corner here, and there's a doctor's office around every corner. So she wrote me a prescription for 3 months, and it was a 90 pill supply. So 90 pills of Imitrex, and I was a little shocked, and I wasn't sure how much it would cost. I was a little scared because I knew this was an expensive drug. But I went to the pharmacy. They gave me the 90-day pill supply, the 90 pills, and it was 50 milligrams a pill, just to give you guys a little bit more information. And I paid 10,000 won, which would be like $9 for a 90-day, 90 pill supply of Imitrex for migraines, which is a very expensive drug in America. So that's how good the national health care is here. It works. It's great for everybody. You don't have to worry about, if I go to the ER, if I just walk in the ER, I'm probably going to have a $5,000 to $10,000 bill. If I have anything serious, God, I might end up having like 20, 30, 40, 50,000, who knows, dollar bill. You don't have to worry about that here. Even I've had friends that have had cancer, and they've gotten months and months of cancer treatment, and it is so affordable here, guys. So affordable. You don't have to worry, oh my gosh, I get a severe problem, I'm going to go broke, I'm going to have to go bankrupt. It doesn't happen here. I mean, as long as you have a little bit of emergency fund, like $1,000 or $2,000, for the most part, that will cover almost every medical catastrophe that could happen to you or your family. So you don't have to have a huge, like, I mean, I would still have an emergency fund here for other reasons. Obviously, it's just smart. But it's not like it's going to cost $10,000 to have appendicitis surgery or tonsils out or pneumonia or cancer. If you know, all these things are not great. We don't want them. But if you do get sick, you want to know, gosh, I can pay for the health care. You know, I've never worried about that here, because I always knew, you know, at the very least, I could put it on a credit card, $1,000, and I can pay it off in a month or two. It's not like going to break you and like drag you through possible bankruptcy and like all these other things, trying to maybe set up a payment plan that a hospital doesn't want to do in America. They never want to do payment plans in America. Hospitals here, some do payment plans for people. Personally, like I said, I just put it on a credit card if I have to and pay it off within a month or 2, 3 months at most, just gradually. But definitely here, a medical catastrophe or a medical emergency will not break you. Why we don't have this system in America, God help. Literally, God help us. Like, honestly, it's crazy. So, I mean, if any of you guys want to share this video, my experiences here, how much I paid, please do. Please do share this. I would love it to be seen by people that maybe are in high places that are skeptical. You know, Trump, if you're out there listening, please get this system. It is so great for everybody. It works for the government. It works for the nurses and doctors. They still get paid well. And it's also great for all the citizens here, or people like me who I work here and am legal. I'm legal here. I'm like on a green card, equivalent to a green card in America. Is so great. And even elective surgeries, like I've had a few elective surgeries, like if you're somebody that has severe acne, and you need lasers from a plastic surgery place, you want to get that done, or there's something that you want to have done with your face that's a little bit more past dermatology, but maybe IPL lasers or that sort of thing, or even plastic surgery if maybe you've had a really badly broken nose and you need to have like reconstruction surgery because your nose is over this way some. Wow, it is so much more affordable here. So not only does the National Health Insurance keep all the necessary health things good price, but it also helps keep like elective things that you might want for other issues in an affordable price. So it actually helps everything. So I just don't know why they don't have this in America. I'm a little bit scared to come back to America and experience healthcare. That's my one big thing that I'm like, ugh, like I'm not looking forward to. So please share this video. If anybody is skeptical of national health insurance, please ask me questions about this system here. I think they should take this system and just pluck it up and put it in America. It would be awesome. Totally awesome, guys. You have no idea how, if this system, if they just plucked it and put it in America, how amazing it would be. You have no idea. I do, because I've lived here. I've experienced it with several medical catastrophes and emergencies. But yes, please, America, please, like all the governors and senators and President Trump, please get national health care. It is undescribable how great it is. And that's all I had to say about it. If anybody has questions, I've been here for 3 years, about the health care. More questions about what it covers, doesn't cover. For the most part, it covers almost everything, guys. It's really good. Just ask, comment. I'm probably going to put this on YouTube and then put a link on Facebook. So comment to me if you have a question down below. And I'd be happy to comment back about the healthcare here, and also the medical system. I do want to say the doctors here, they are just as great as America. I just want to put that out there real quick. I've never had a problem with healthcare here. It's the same as America. This is not a third world. This is not a third world country. It's kind of like a mini America living here. So I just want to say that real quick. But comment your questions below. If you have any about this plan, I will try my best to answer them from my knowledge, or my husband's Korean. I will have him kind of tell me, and then I can answer back. But I'm pretty sure I will know almost everything. Alright guys, peace, and talk to you guys later.